guys, so my name is Stephanie. I work in the medical field and I work with family practice currently. So at this presentation, I want to persuade you into preventing urinary tract infections and how to give that clean catch urine sample for a culture. So how many of you guys have ever had UTIs? Raise up your hand. So that's surprising, right? More than half of you guys have had urinary tract infections. That's how common they are. So at the end of this speech, I want you guys to really understand how to prevent these UTIs and how to give that clean catch sample. So why is it important? Even if you've never had a urinary tract infection, you can still get one in the future. So you need to realize how the symptoms are and how to give that sample. So people at higher risk are women and girls because they have a shorter urethra and it's closer to the anus than in men. Previous UTIs, sexual activity, menopause, use of spermicides, pregnancy, older adults, reduced mobility, kidney stones, and prostate enlargements can put you at higher risk of getting UTIs. The CDC says that UTIs can occur when bacteria enters from the urethra and infects the urinary tract, which the most common is a bacterial infection. You can prevent UTIs by urinating before and after sex to help flush that bacteria out, drinking lots of fluids, urinating often, showers versus baths, especially for children, douching, personal sprays, and powders in the genital areas. In children, you want to teach your girls how to teach from front to back instead of from back to front. You need to encourage them to come inside every once in a while to come and urinate instead of holding that urine. So once you recognize the symptoms of a urinary tract infection, you're going to make an appointment for your to see your doctor. They're going to ask for a urine sample, and that urine sample is going to be run for a urinalysis dipstick. According to WebMD, a urinalysis consists of the clarity, which tells you if the urine is cloudy or clear. If it's cloudy, that can mean bacteria, sperm, or mucus. The smell. So bacteria can make the urine have a really bad odor, which is important because it can give them that first indication. But the most important in a UA is leukocytes and nitrites. Leukocytes are white blood cells that can fight off infections, or fight off bacteria, so it's important to see those too. Nitrites are also showing a UTI because urine nitrates are converted into urine nitrites when there's a bacterial infection in the urinary tract. So once the UA is done and it comes up with nitrites and leukocytes, your doctor's going to ask you for a clean catch urine sample. A culture in the urine is the urine is spread across an agar plate and incubated for 2 days to see if the bacteria grows. If that bacteria comes back and it's not the bacteria that they're looking for, then it comes back and says that it was contaminated. So somehow in the procedure where you were giving that urine sample, you contaminated it with some of your own bacteria. So according to WebMD, a proper way to collect a clean catch midstream urine sample, the first thing to do is wash your hands. You're going to be given a urine cup with 3 wipes. The first thing you're going to do is open up the cup, making sure not to touch the inside of the lid or the cup. Face the lid facing up so that no bacteria gets on it. For men, you're going to use the first swipe to wipe from the right side from front to back on the side of the urethra, front to back on the left side of the urethra, and front to back on the front of the urethra. For women, you're going to spread open the labia to expose the urethra, front to back on the right side, front to back on the left side, and front to back on the middle. And always for girls, you're going to keep that labia open to make sure that no other bacteria. So for 2 seconds, you're going to urinate into the toilet, never stopping the flow. Urinate until you get about 2 ounces of urine in the cup, and then continue urinating into the toilet. Once you get your urine sample, you're going to get your lid, and again, don't touch the inside, close it up, and label it with your name and date of birth. So once you do all that, your doctor's going to let you know what grew out of that urine sample. So it's important for me because many patients that come in here are in pain. They don't have a lot of money, and they don't have time to even come into the doctor's office as it is. So by doing this properly the first time around, you won't have to come back, get that second copay, and you won't have to repeat the whole lab, which can cost you about $100 to run that urine culture. So in conclusion, wiping from front to back can help eliminate that bacteria from coming up into the urethra. It can save you lots of money, especially on the lab and the doctor's visits. And I wanted to show you guys a E. coli. So this is E. coli in the petri dish in the culture that's done. And so that's how it looks like when in the petri dish. And these are all from the CDC. E. coli, this is E. coli in the magnification in the microscope, and this is the bacteria from the anus coming into the urethra. So this is how close it is and how close it can travel up, and that's the urinary bladder. So also a reminder that overusing antibiotics can help you or can make you become resistant to that medication, and it can stop working after a while. So you also don't want to get too many UTIs, and then antibiotics won't work for you. So again, thank you guys. I hope that you guys learned how to prevent urinary tract infections and how to avoid all of these extra costs. Let me record everybody around me. Everybody stuck around.